So I'd like to call Matt up here at this time, and we're going to do his new member induction. For those of you that are maybe new to the community, this is Matt Mihalik, and Matt will talk. He can talk sometime with a new member talk about what it was like to grow up in Sedro Woolley and what it was like to grow up with his dad, who likes to talk when we're doing presentations. So let's begin. President Wyrick, fellow Rotarians and guests, it is indeed an honor to induct Matt Mihalik as the newest member of the Sedro Woolley Rotary Club. The mission of the Rotary is to provide service to others, promote high ethical standards, and advance world understanding, goodwill, and peace through its fellowship with business professionals and community leaders. We are not a political organization, but dedicated to the practice of good citizenship. We are not a charitable organization, but are dedicated to helping our fellow man or woman. We are not a religious organization, but are dedicated to the ideals of morality and high ethical standards. We bring together our individual skills, resources, and qualities of leadership to improve the quality of life for people, not only in our local communities, but also in the communities around the world. Matt, you've been chosen for membership in the Rotary Club Sedro Woolley because the Rotarians of the club feel you possess the qualities of leadership in your field, the qualities of personal conduct, the willingness to share these qualities with personal contact, but all directed towards the pursuance of Rotary's mission. It has to be said that when a Sedro Woolley Rotarian is asked to perform, the answer is yes. So, President Wyrick, fellow Rotarians and guests, please join me in welcoming Matt Mihalik as the newest member of the Rotary Club of Sedro Woolley. Let's give him a hand. So, Matt, you have a favorable certificate you can put in your bedroom or your office. It also has your dues in it, and with your dues, you get a name tag that I know you'll probably wear at every meeting. So, Matt, welcome to our Rotary Club, and I can personally vouch for Matt. He'll be a good member and a contributing member to our club that we can count on to really do the good work for our community. So, Matt, congratulations.
Thank you.
Yep.
Thank you, Mark, and congratulations, Matt. We're glad to have you in the club. Chuck, you have a word to say about the barbecue? Mark, can you give him this?
Well, we're back having our annual 7 barbecue. It'll be 2 weeks from tonight, the 2nd. Starts at 5 o'clock at Riverfront Park. So urge all of you to bring your families, friends, whatever, and we'll be announcing this further again. Tonight we're having a committee meeting at 5 o'clock at the Iron Mountain Bar and Grill. So those on the committee, if you can be there, that'd be great. We can tie up the loose ends. So hope to see you all there.
Thank you, Chuck. On the following week, on September 9th, is the annual golf tournament at Overlook Golf Course. Nick is heading that up. I don't think he's here today, but get yourself a partner and get signed up for that. That should be a fun event. Anniversaries, which were supposed to be today, have been postponed 1 week. And so we'll get a reprieve. And I think I probably owe $20 because I'm not going to be here next week when we do the anniversaries. I would have been here this week, but I am here this week, but next week I won't. So there's $20 for the Sergeant at Arms. Are there any other announcements? Seeing none, how about the Wheel of Fortune?
Okay, we're going to do 4 drawings today. We'll have a choice, of course, of the wheel. You can spin the wheel. We have a Roseau. We have a Petite Noir and a red blend from Menage a Trois. For those who speak French, you know what that means. We have socks, 3 pair of socks. One's a Carhartt, Mike, and a 6-pack of beer IPA. So first number is 1919. Okay, Mike Swigert. Did you ask your wife what you should choose? God, unbelievable. Is it? It's 40 or 41. Next is number 40. That's me. Woo! I think I'll take the wine. Okay. Next number is 31. 31. Lucky table. Good. You've got wine, you've got socks, and you've got beer. But you can spin the wheel too. Who's going to take the beer? Go for it. So these socks are nice. And last but not least, number 25. Phil. Phil's going to spin. $25 cash. Way to go, Phil.
Last 2 times I won, it's just paid $2.
Yeah, we got it back. That's karma.
Well, time for Sergeant Arms.
Sergeant Christine. Yep.
Okay, folks, I have some very exciting true or false trivia here. Phil has to pay $2 right now because he keeps talking. See, he's not even paying attention. And can I get 2 people to collect money for me, please? For real, Mike and Eric. Hello, Eric. Thanks. Okay, so I'm going to start here. It's just true or false trivia, but it has to be a general consensus, okay? True or false? Blue eyes are newer to the human race than pottery. It is, that is correct. A 2008 study traced the gene for blue eyes to a person who lived 10,000 years ago, and pottery dates back to at least 20,000 years ago. All right, true or false? Phil's gonna know this one, I know. 50 Cent, the rapper 50 Cent, and Charlie Chaplin were alive at the same time. True or false? It is true. Everybody at this table needs to pay $2. Charlie Chaplin died when 50 Cent was about 2.5 years old. All right, guys. True or false? Trees existed before sharks. True or false? Trees existed before sharks. That is correct. It's false. The earliest shark fossil dates back to 420 million years ago, and the first trees appeared on Earth about 408 million years ago. Okay. True or false? Michigan is larger than Great Britain. It is true. Good job. Man, you guys are too good at this. I'm going to make everybody pay at the end anyways. Okay. True or false? Cumulus clouds weigh anywhere from 15 to 30 pounds. We need a consensus here, people. True? All right, it's false. Cumulus clouds can weigh more than 1 million pounds. They're full of rain. All right. Oops. $2 for incorrect. All right, guys, matches were invented before lighters, true or false? It's false. The first push button lighter, the Dobringer lamp, was invented in 1824, and the practical friction matches, similar to what we use today, were invented in 1827. All right, guys, $2 for the incorrect answer. Let's move on to Happy Bucks. Carl's holding up $100 bill, so I'm coming here first.
Fellow Rotarians, I am very, very pleased with each and every one of you that have participated in our work party that we had moving my residence. It was pretty much a lot of work, and Don over there gets a special notice. I mean, he brought these 3 boys of his that are like football players, literally, and they helped with all the heavy stuff. So with sincere, really sincere gratitude from Yulia and I, thank you, Rotary Club, for the work party. $100.
Thanks, Kyle.
I have happy $20 to actually get back involved in Rotary. My wife planned a summer where we have spent 5 of the last 6 weekends out of the house. So like all of these events that have been going on, I've been gone. I think she got a little overexcited with what after being home for a year. She's like, all right, we're doing this and this. We're going to the coast and we're going to Leavenworth. We're going camping. And I'm like, okay, let's just calm down a little bit. And then I started my new job about a month ago. And so now I think things are settling down a little bit. So hopefully I'll be able to start coming to some more events and doing some more stuff. So I'm excited and happy to be back. $20. I'm extremely pleased that my son is a new member of this club. And I got another 20 to explain why I never proposed him myself. Over the years, I've asked 3 people to become members. They all declined me. Sue Strata, past secretary, Mike Janicki, past president, and John Janicki. So I had this thing that it might be me. And there's no way I could feel good at all if my son declined me. So there we are. It's another $20.
I got $5. I mean, I probably could just give you my whole wallet for how things been going the last month. But the $5 is because Adam and Brittany had twins a couple days ago, and everyone's happy and everyone, I mean, it's all working out. They're supposed to come home tomorrow. But John's not here, so there's no one here to really know what their names are. So next week you'll have, so it's a girl and a boy. That's all I can tell you. And then next week I'll know the names because I'm going to have them email it to me, and so I'll remember them. But anyhow, everyone's happy, and I just want to thank everyone for last weekend. It meant a lot to our family to see 350 people there. So thank you guys very much.
Yeah.
Oh, okay. All right. Does anybody else want to just hand me money?
I would like to do this till we can get together in person, but I have a happy 20. During the pandemic, I had 2 granddaughters born, one in Louisiana and one in down in Falls City in King County. So their names are Virginia and Violet. So happy 20 to our two new granddaughters that were born in a pandemic. So.
Anyone else happy, indifferent? I'm going to contribute $5 because that's all I can afford because I just lost most of my money in Las Vegas. Yep.
Thank you. Time for early leavers. Well, today we have probably one of the hardest working people in Skagit County for the last year and a half. That's Jennifer Johnson, who's the head of the health department. She's been with Skagit County for 18 years, was with senior services, then human services, and became head of the health department several years ago. Jennifer is going to give us an update on the COVID outbreak or the pandemic or whatever you want to call this horrible thing. And so welcome, Jennifer.
Okay. Hello, everyone. I'm Jennifer Johnson, and I'm so happy to be here. So nice to be doing this not in Zoom. I think I've provided you updates via Zoom a couple times, and so it's really nice to be here. I have to tell you, of all the groups and places that I get asked to present, your Rotary is my favorite. And the reason why is just because of this sense of community that I always feel when I am part of your group. And I even felt that when it was by Zoom. So I just, I don't get that same feeling from other groups. And so you've really got a special community and a really special group of people. And I don't know, it's just very impressive. So happy to be here. I don't have the best news to share though. I wish that I could tell you that this COVID thing, that we're getting past it, that we've made, and that we're going to be able to truly keep our lives more normal or revisit what normal is, but that's not the case. We're in the 5th wave right now, and you could go ahead and advance. Great. So we are in our 5th wave, and we have seen an uptick of cases over the last month. We had, 84 case days some days. So it's not great. As of yesterday, we had a total of 7,000 cases, which I know doesn't, really mean a lot. But if you notice on the bottom here, we've had an increase of 436 new cases since August 11th. So we're really in the height of it. We've got a lot of outbreaks right now in long-term care facilities. They're relatively small numbers, but still they're considered an outbreak, which is extremely concerning. And then we've got 5 or 6 cases associated with the watershed concert and a lot of different things in our community that have an increase of cases. Do you mind going forward? One of the most concerning things right now would be the hospitalizations. Once again, our hospitals are full. A couple of days ago, we had 24 people at Skagit Valley Hospital, 2 of which were on ventilators. We had 5 at Island Hospital, 3 of which are on ventilators. And the last I checked up at Peace Health, St. Joe's, which is where United General Peace Health sends their patients as well, they had in the mid-30s in their COVID unit. One thing I want to point out, and I'll get to it in a little bit, is there's a lot of talk about breakthrough cases, and we are seeing an increase of breakthrough cases. That means people that are fully vaccinated testing positive for COVID. But what I will tell you is that even though we've seen an increase of that, it's still under 10%. And the severity of the illness is much, much less. We have only had 2 hospitalizations that are breakthrough cases, and those 2 people were over 70 and had very complicated health situations. So, there is a little bit of an increase of people that are fully vaccinated becoming positive, but many of them are asymptomatic, and they're certainly not as severe and certainly not dying from COVID. So, if you want to go ahead and increase. Oh, great. What do I push? The down. Oh, oopsie. Ooh, I get to be in control of my own slides now. That's great. So I guess just back to what we're seeing right now, that last dot, blue dot to the right, it shows that we are currently at 304 cases per 100,000 residents. We are almost, that dotted line is going to take us over 400. So we're likely going to be higher than we have in any of the other waves of this pandemic. We, for quite a while, when the governor opened up, regulations in June, we were below 100. So this is a very significant difference for our community, which is quite concerning. Vaccination still is the absolute best tool that we have. Even with the breakthrough cases, like I said, we are not seeing the severity of illness and death that is tied to that. And we're not where we need to be with vaccination. For us, we have 67% that have received first dose vaccine in Skagit County. The governor had a metric that he wanted it to be over 70%, and I would like to see it higher than that, because that is, like I said, the best tool that we have to be able to resume lives and to be able to stop people from getting unnecessarily hurt. Vaccine. You probably saw some information about booster shots. Please speak with your healthcare provider about getting an additional dose, and if that is appropriate for you. CDC does not recommend additional doses or booster shots for any other population, so it's for a very specific population based on the immune system, and I can send you the criteria if that interests you. However, there is talk of a 3rd booster dose that may be recommended at the 8-month mark after being fully vaccinated, and we should see more direction on that towards the end of September. So public health is gearing up with the assumption that there will be a 3rd booster dose recommended, and that we'll need to be able to be a partner to serve the community and help people get access to that as easily as possible. A person receiving a 3rd dose should get it at least 28 days after their 2nd dose. That's if they meet the criteria right now for that 3rd dose, and it's a pretty limited criteria. People who receive Johnson & Johnson should not get a 2nd dose. Boosters, like I said, they might be required in the fall, and we're waiting currently for determinations from the FDA for what that criteria will look like. It still remains that vaccine is approved or is for anyone 12 and older. We are suspecting that soon it will be authorized for younger ages. The vaccine that is authorized for people under age 18 is sorry, why am I having a mind, Pfizer. So it's not Moderna and it's not Johnson & Johnson. Sorry for the mind blank there. We are continuing, we as in public health, not me, I can't give vaccine, but we are providing vaccine at pop-up clinics. We stopped our operation of our mass vaccination site at the fairgrounds the end of June. And that's just that our numbers had decreased so substantially. And we found at that point that it seemed that most people who wanted vaccine had sought it out. And so we started going to where people were at. And I mean, we've had pop-up clinics everywhere possible, fireworks shows, Skagit Speedway, lots and lots and lots of community events and locations. And, you know, what we hear mostly from a lot of people, it's not that they're necessarily vaccine hesitant, they're just indifferent. And it's, you know, it's one more thing for them to have to do in their day. And by us being there, they've been like, yes, sure, why not? And they end up getting vaccinated and often, you know, report things like, I wouldn't have done this if you just didn't make it so easy and you were right here. And now I can call my mom and she's going to be super happy with me as well. So we hear some pretty funny things. Knowing that we're kind of in a planning phase right now, knowing that we see this huge increase of cases, we also know that we're going into fall. And if you remember last year, when we moved into fall with more indoor activity, we did see a substantial increase in cases, especially going towards the holidays and gatherings. So what we've seen is a couple things. We've seen a lot of people that are wanting to be tested. You know, we had stopped testing at the fairgrounds late spring, and the community providers that exist just can't keep up with the demand. Some of that is travel, and some of it is that people are sick. They have symptoms or they have known exposures from moving around more. So we're in the process of figuring out if we're going to go back and operate at the fairgrounds or at a different location to be able to have that low barrier access where anyone can just come and get tested. Same with vaccine, we're likely going to go back to a one location that serves the entire county. With the booster shots, it'll just be more effective than doing all these pop-up clinics everywhere. We know there's going to be gaps, especially in East County. So we will, you know, make some plans to be able to serve them as well. I guess I'm not following my slides very well. So the Delta variant, I get asked all the time if all of our positives are tested for the Delta variant, and the answer is no. The state has a certain quantity of lab results that they're sequencing for the Delta variant, and based on statistical calculations, they have estimates as to how prevalent that Delta variant is in our community. We know that it's a highly contagious variant and that it's a much more transmissible strain of the virus. And we know that it's the dominant strain in Washington. The state, through their statistical calculations, are estimating that it's making up approximately 3/4 of the cases. 76% of the COVID positives are suspected to be the Delta variant. So that's concerning. While no vaccines are 100% effective, it's proven, like I said, that the vaccine is our strongest tool to be able to stop the spread, and it does prevent severe illness and hospitalization. So when looking at breakthrough, I said that our cases were under 10%. We're at 7% in Washington. And of those breakthrough cases, 66 have died for a COVID-related illness in Washington. In Skagit County, we've had 0, and we've had 2 hospitalizations, like I had said earlier. It is still recommended that if people have symptoms, that they get tested. So all of the guidelines that I've shared with you in the past and that you've seen in the media still stand. If you're sick, stay home. Don't assume it's a cold. Don't assume it's a sinus infection. Don't assume it's, just don't assume. just, it'd be better to assume that it could be COVID. And so at the very minimum, don't go around people if you're sick, but it would be, getting tested is great so that, the same thing that we can notify people that may have been a close contact so that they don't continue to spread it as well, given the incubation of the virus. All of that still remains. What has changed, a little bit will be that if you are a close contact, the guidelines have changed if you're vaccinated. So if you are fully vaccinated and you are a close contact of someone, you do not need to isolate or quarantine unless you have symptoms. When you have symptoms, then that triggers the isolation and quarantine criteria. So, I think the best rule of thumb is if you think you could be ill, or if you just don't go around people. It's really that simple. So that's for our workplaces, that's in our social lives. I know in my circle of friends, I have younger children. It's amazing to me how many times I'm in situations and I have people telling me that they have allergies or it's just a cold, and they don't really know that. And they're still around people, they're still going to social gatherings, they're still hugging people and they're touching people and, spitting on people from, whatever they're doing. Not really spitting, but just from, talking and singing and whatever they're doing. And it's almost as if, it's that whole thought that it's not me. It's for sure not me. I don't have COVID. And I think that's the biggest culprit to what's going on with the increase of cases. And then where people are going to work in these social gatherings and it just continues to replicate. We are doing vaccine pop-up clinic and testing every Wednesday night right now downtown Mount Vernon, where the Skagit County admin building right next to the courthouse. The testing is outside. We go to people's cars. They do not come in a building. So that is a possibility right now to fill the gap, but it's short-lived. It's only for a few weeks, and we're really working on a more stable, long-term solution to be able to serve the community. But I just wanted you all to know that there is an option in the evenings open once a week, should you or a community member need that. So masking. The guidance, I don't know if you're all aware, but the governor announced yesterday that starting Monday, August 23rd, that's this next Monday, masking will be required indoors for all people, whether you're vaccinated or not. So regardless of vaccination status, this is going to be required in places like restaurants, grocery stores, malls, and public-facing offices. So that goes into effect on Monday. Masks are also recommended for people in crowded outdoor settings. So if you're going to be shoulder to shoulder and in close contact, that is advised to stop the spread of the virus. And for indoor, recommendations too, I always get asked this, can I serve food? Can I eat food? And the answer is yes. Yes, you can. So, obviously we don't wear a mask when we're eating and drinking, but wearing a mask all other times is what that recommendation is. There's absolutely no guidelines from the governor that you can't eat. So just want to make sure people know that. I get asked that all the time. So additionally, yesterday, the governor announced that he is going to be requiring vaccination for K through 12, private, charter, and higher education staff and educators. And this will be required the same date as the state employees and healthcare workers, which is by October 18th. Personal exemptions will not be allowed. And this, there's been no discussion about student requirements and likely won't be until FDA approves the vaccination. So that's where we're at with that. So I guess at this time, I would like to just ask if there's any questions. Yep, okay, so I just got asked what the difference is between isolation and quarantine. Isolation is what you do if you are COVID positive, that you then have to isolate from others for a set amount of days, and that's based on symptoms and being retested. Quarantine is if you are a close contact, then you are quarantined. So that's the difference, whether you are positive or not positive, and that does vary. Those guidance changes whether you're vaccinated or not. Mike?
Yeah, I have like 8 employees that have all gotten sick. You know, whatever they did, they got sick, doesn't matter how they got there, but, tested positive, went through the process. And now they're telling me that they don't need to get vaccinated because they said they got the real thing and their antibodies killed the real thing. Why would they put something else in their body? I want to hit them with a crowbar, but I really just, you know, how do I get to them?
Yeah, they're wrong. That's absolutely incorrect. So if you're going to hit them with a crowbar, can I come? No, but that's incorrect. There is official recommendations that even if you've tested COVID positive, to get vaccinated. You know, and it's just, honestly, it still remains that there's so much unknown about the mutation of this virus and the mutation to the variants and what, you know, and what that means for people, you know, not being able to be, you know, infected. But there are many people that are COVID positive or have been COVID positive and get it again. So it can happen. Just like you can get it if you're vaccinated, but as you saw, a 7% rate is pretty low. So, good question. Sorry.
So I might have been the one that asked you to come here today. My sister-in-law is a hospice nurse, retired or used to be, and now she runs a nursing program in Kansas. And her church lost 2 members to the Delta variant about 3 weeks ago. And she's freaking out over the spread of the Delta variant. And I got another nurse that wrote a really thoughtful email, and this helps explain the Delta variant, I think. There's an R0 rating for the spreadability of the disease. The coronavirus originally had an R0 rating of 2.5. The chickenpox has an R0 rating of 8. So it was much more easily spread than the coronavirus. The Delta variant has an R0 rating of 5 to 7, according to this person. So it's not quite as wildfire as chickenpox, but it's kind of close. So I just wanted to share that information.
Yeah, I didn't talk about R0 values. I figured everybody would go to sleep, especially after a delicious big lunch like you just had. But it is more contagious. It is definitely more transmissible, about double. So.
How bad is it? What is the death rate of people that have been vaccinated or have already had? It seems to me like our government doesn't provide the nitty-gritty of all of the detail for the people that really want help. So that's kind of unfortunate. It would be nice if we had transparency completely on all of it.
Yep. Yep. Yeah, so here in Skagit County, we've had 0 deaths of people that have been vaccinated and have then gotten COVID. That's correct. So they've been fully vaccinated 2 weeks post their last dose, whatever vaccine they had. And there's been 0 deaths and there's been 2 hospitalizations. in Skagit County, for Skagit County residents. And those hospitalizations, they were over 70 years old and had very complicated, complex medical situations. Our breakthrough rate in Skagit County is, it's under 10, it fluctuates. It fluctuates between like 5 and 8%, just depending on the day. And, you know, like I said, there's only been 2 hospitalizations. So many of the individuals, when we do disease investigation, report that they didn't even know. They had no symptoms. They just got tested out of an abundance of caution because they found out that they were at a gathering or they were close to someone who may have been sick or who was sick. So it's accidental findings in a lot of cases. There are individuals that have more flu-like symptoms. It's the same kind of respiratory fever type of illness as, you know, when COVID first came to be, but nothing that's taking them to the doctor in the hospital, and, you know, they return to life and work relatively quickly, as we do with, you know, just kind of common viruses and flu and colds. The antigen test and the PCR test are different. The PCR test is more accurate. And remember, regardless of what test it is a snapshot of time on that particular day that you get the test. You know, there's a pretty large incubation of the virus. So if you went to a party last night and you went and got tested today because you found out somebody there tested positive and you got a negative result, that could be a false sense of security. So you really, you know, want to wait, you know, 4 or 5 days to go get tested from a potential exposure. How accurate is the test? There are sometimes, you know, false positives and negatives. It's highly accurate. I mean, it's like less than 1% that there's problems. Antigen test is a little bit different. It's not as sensitive.
So Jennifer, we've got a couple of questions here. Talk about the rapid, I had a rapid test this week. I just came back from Alaska, but cost me almost $50 to get it. Are there any places people could go here to have a free rapid test that they could find out?
Yeah, you can come to Public Health on Wednesday nights, 6 to 9 p.m. downtown, and it's free. You can also contact us, and we've got a lot of kits, and we can help do that. We're getting them out to employers in different types of locations, and we're working on expanding that. So, yeah, you can come to us. And I think, I'm sorry, Eric keeps raising his hand, but nobody behind can see. No, we keep being told that it's any day. We expected it about the 3rd week of August, which is where we're at. So I've not heard an update from there. Hopefully by September, I mean, it really should be any day, but who knows?
Is that airline approved?
Nope. Nope. Yeah, antigen tests are not approved for most travel. So you'll want, if you're traveling, you'll want to check that. Yeah.
Hi, I have a question about what, as you're the director of public health for the county, what is the county going to do to help educate folks throughout the county about what you've stated about antibodies? Because we hear a lot of misinformation. And could we get the scientists and medical folks to talk about, from a position of authority, about antibodies, about how communicable it is. My concern is my wife is an urgent care medical doctor, sees 36 patients a day, and 25% of those folks are under 25 thinking, I can't get this. What do you mean I'm going to the hospital? I just have allergy or sniffles, as you said. And at what point do we encourage folks to say, well, is there a temperature threshold? You know, I'm like the other Carl in the room. I want some sort of data point of in my engineering brain here to go, okay, this is the time to go. Thank you.
So let me see if I can, there's lots of questions kind of embedded in that one comment. yes, we can, I will let our communications coordinator know that there's been interest in talk here about antibodies, and if we can do more messaging, we've done messaging. It's hard, I mean, I don't think, a lot of Skagit County residents, really get excited about reading Skagit County press releases. So, we know that that's not, I mean, we think they're really good, but, as a citizen, I don't go looking for my information that way. So we know that. And so we're really working on getting that information out in different ways. We've got a blog, we're on different social media. So the fact that you and Mike also brought that up, we will keep that in mind and really enhance some of the education and messaging that we're doing. Quite frankly, like with anything, there's just that it's not me. It's not going to happen to me. I'm invincible. And so we'll have to, I think, we'll be able to work with the schools too, especially with the younger folks with that. As far as a threshold about, when you go and when you don't, when you're sick, it's the same as, with any illness. If you've got a fever that's, over 103, if what happens with COVID is people are sick and then all of a sudden they really quickly take a turn for the worse. And, it's a hard thing to put a data point to because everybody's so different and your medical situations are different. So it's just the same as any other illness, watching that fever over 103, 104, and kind of knowing if you've been able to drink, are you still, urinating? What are you doing from a hydration perspective? And do you have people around that can watch you? And if you don't, then maybe that would trigger going to the emergency room a little bit quicker. Did I answer all your questions? Okay, whew, I'm having some memory problems lately.
What's the distinction between COVID-related illness on your slide and COVID period?
And COVID what?
And just COVID, because COVID-related illness is a very specific
That's
phrase.
died. So the 66 are people that have died of the breakthrough cases. And the reason why it's worded that way is it's a careful way of wording it because sometimes is it the chicken or the egg when people pass away. And so that's how the state is wording it. Because it may, they may at that time not be testing positive for COVID and it could turn into pneumonia or could be turn into other complications that exacerbate other types of medical issues. So it's just a technical way of wording it, given that there's a lot of unknowns, to be totally honest. It's not my wording, it's from the state. It's not what we made up or didn't make up at Skagit County Public Health.
Jennifer, we're doing the Blast from the Past in September. And, some people have brought up to me with the fact that the numbers are going up, whether this is wise or not. And we have masks available to hand out. We've chosen not to have food vendors there, but we would also love to have you come on Saturday, and United General Hospital will be in the gazebo area. And that would be a great way to help push the public. So if you wanted to do that, just let me know. I'm Paula with the Chamber of Commerce.
Okay, so you mean like to vaccinate and test people?
Yeah.
Okay. What was the date?
It would be September 11th.
And it's called Blast of the Past?
Blast from the Past. Oh,
okay. I'll have my mobile team reach out and get that scheduled. We'd be happy to be there.
okay.
It might be me, I don't give vaccinations, although I want to.
I love it. Thank you.
Yeah. Yes.
Just say 80%.
Thank you. That's, yes.
most all of the nurses. So it was the people that are not are maybe not as scientifically educated, I would say. Not all of them, but the vast majority of very educated people are dying, would die to get it. So they wouldn't die of COVID.
Yeah, it does.
But what's the breakdown of those
And that
professionals?
goes for first responders too. I mean, and it's across the board, and not every employee at public health is vaccinated. My response that I really wanted to say that is it's just stupid. It's stupid not to get vaccinated. That's pretty unprofessional though. So if I was to search through my brain and find a more appropriate response, you know, it's hard to do that. It is the absolute best tool that we have. And I understand that people may feel differently, but that is what we know.
Hey, thank you,
Yeah.
Jennifer. Yeah, thank you. Yeah.
Thanks.
She may not be able to say it, I will. It's stupid not to get vaccinated. Jennifer, here's a pen. Thank you for coming today. Appreciate it. And thank you, Alyssa and Carissa, for coming. And with that, everybody remember to bring their masks next Thursday when we meet.